Okay, I'm Jennifer, and this is my first time ever trying to vlog. So, I just want...
Sorry.
Will you stop?
Hi.
Hi, that's my baby Rachel. And the purpose of this video is to help educate people about breast cancer. Now, on September 15th, I was diagnosed with breast cancer through a mammogram and a biopsy. A lady at the Parkland Outreach actually saved my life by saying that I needed a mammogram because of my age. And when I got the mammogram, I needed a biopsy, and the biopsy confirmed that yes, indeed, I did have breast cancer. So I was scheduled for a lumpectomy on October 16th. But before the lumpectomy, I had to get a few tests, a bone scan, DNA tests to make sure that, it wasn't because of, I don't know, a gene mutation or something, and it wasn't. But they did find in the breast MRI that I had a few more places in my right breast that had cancer in them. So the doctor canceled my lumpectomy and said that it would be a better recommendation for me to get a mastectomy because of all the different places that I had cancer in the right breast. My next step was to see the plastic surgeon and to discuss reconstruction. So he said, because of the size of my breast, I had a size J, that I would have to get the mastectomy on one breast and a breast reduction on the other breast, and then reconstruction on the right breast. So, or otherwise I could choose to get a double mastectomy, which would get rid of the chances that I might get breast cancer in the left breast. So we went ahead and went with that. So on December 18th, I got a double mastectomy. And man, I keep thinking whenever these happen, this next thing I think is the last thing, and it's not. Cancer has turned out to be a longer process to cure than I thought it would. But I believe strongly and firmly that I am going to be cured. So I've had my double mastectomy, and I just got introduced to the medical oncologist at Baylor. I've got Baylor insurance now. And she said from the pathology report that they got all of the cancer out of my right breast, that there was no cancer in the left, but that whenever they do a mastectomy, they take a lymph node out of an axillary lymph node, which means a lymph node from your armpit on the side where you have cancer, and they biopsy it. When they biopsied it, they said they found about 15 cancer cells in the lymph node. And so they really don't want it to spread because the cancer ended up being in the very beginning stages, but it ended up being kind of an aggressive kind of cancer. So they want to make sure that it doesn't come back or manifest somewhere else, because they don't really know whether or not more lymph nodes got attacked by the cancer. So in 2 weeks, I get to go through chemo and lose my hair. Yay! I'm really not upset about it. I'm not going to die, because she said that at this stage, when the cancer cells are so microscopic, that even if it has traveled to other lymph nodes, that this kind of chemo will cure it, will get it all. But if I decided not to go through chemo, that it could become very aggressive and attack other organs. Not yet. Aww. Okay, hang on. I'm just trying to look and see what else I wanted to tell them in this video. Okay, here it is. So I've decided to document my journey, because I really wanted to know more about it when I first was diagnosed with it. I mean, I would look for videos or anything I could read about breast cancer, about people that were going through it right now, what it was like. And I want people to know what it's like exactly. So I want people to ask me a lot of questions. Of course, I'm not an expert, but since I'm going through it, maybe there's something I could tell you that you didn't know. I want to help, you know. If I have to go through all this crap, I want to help. I want to be able to help somebody else that's going through it. It's tough. It's a tough thing to go through because nobody tells you about it. It's not something that everybody's generally educated about. Do you know that some of the people that I've talked to didn't even know what a mastectomy was when I told them I was going to have a mastectomy? They're like, really? What's that? And so I have to tell them. And then when they told me I had to have chemo, I really didn't even know exactly what it was. But what else? Let's see. So I want anybody that has been diagnosed with breast cancer or has been touched in any way by a family member or a friend going through breast cancer to ask some questions in the comments, and I'll try to do my best to get back to everybody. Let's see. I don't know. I guess where we are right now is 4.5 weeks after the mastectomy. Right now I have expanders in my chest so that to expand the skin and the muscles around there so that I can get reconstruction. I've also got these drains. They're tubes that go from inside my body where the surgery was, and they go into these little bubbles, and I have to drain them out, and that's really gross. And they said that most people have them for 2 or 3 weeks. I've had them for 4.5 weeks, and it's really getting on my nerves. But I think I'm about at the level where I can finally get them taken out. And then Monday, I have an appointment for echo on my heart. They said it's like a sonogram on your heart. And then after that will be my appointment to get my port put in. Maybe I'll do maybe I'll do a vlog that day. Anyways, I just want to keep everybody informed during this journey. So, anyways, thanks for listening, and just stay tuned in, and maybe we'll find out about what's going on here. Thanks. Bye.